and welcome everyone. So I'll try to get through this so that we can watch the wedding stream later. So, okay, to start, basically, the quest for like youthfulness and beauty is inherent in all of mankind. Dating back over 3,500 years ago, there's evidence that Egyptians used to use things to beautify the skin, including animal oils and alabaster to exfoliate. The alpha hydroxy acids have actually played a significant role in beautification and eternal youth throughout history. Back Cleopatra in 57 BC used to bathe in like sour milk or lactic acid. The 1700s, French women used to use aged wine to apply to their skin for the tartaric acid to improve their skin. But you can see how through evolution, we've really evolved into numerous more effective treatments and a better understanding of the aging and process and how to correct it. So this eternal youth quest is going to continue. There's still over 78 million baby boomers, and every 7 seconds a woman turns 50. So now they say 50 is the new 30, and people are starting at much younger age with the millennials actually in kind of helping their skin to prevent the aging process. So the overall trend is to start earlier and do more preventative treatments. So unfortunately, we still have not found that fountain of youth, but we've evolved to have numerous treatments that we can combine to actually give ourselves a much more youthful appearance and improve our skin texture and hopefully even help prevent skin cancers. So as you can see, we have everything from our home care products and cosmeceuticals up to cosmetic surgery on the end of the spectrum. But in between, we can kind of tailor our procedures to address the patient's needs. So the overall trend, though, in the past probably 5 to 10 years has been towards the non-invasive treatments. Our patients are becoming increasingly demanding on less downtime. They want maximum results, so they want instant results, without kind of any healing or potential risk of complications. This is in the American Society of Plastic Surgeons' most recent survey in 2017. Botox still is the most prevalent procedure. It was up 4% again over the previous year, followed by fillers. But chemical peels are actually kind of getting an increased resurgence due to their kind of tried and true features and their effects, so that they're becoming more popular again as they're certainly more affordable. And some of our other procedures, microdermabrasion and laser hair, are becoming a little bit less popular. So the unfortunate part is that our most popular procedures don't give us a full surface renewal. Our Botox, our fillers, our kind of reshaping lasers, for tissue tightening and for like liposculpting, and even cosmetic surgery don't give us any kind of surface change. So you can see in this patient, we can, give her Botox, we can do a facelift, but if we don't resurface that skin and normalize that texture and get rid of that dyspigmentation, it's not going to look like she really had any kind of surface renewal or any youthful appearance. So we really need to address both the epidermal and the dermal compartments when we're doing skin rejuvenation. So what we need to do is combine these techniques that will give us epidermal repair and smoothing of the skin with our epidermal to really plump that matrix and actually give an overall skin rejuvenation. So our goals in skin rejuvenation are to smooth the skin. We want to minimize, the fine lines, the coarser wrinkles, get rid of any scars. We want to stimulate that epidermal and dermal repair and really plump that dermal matrix, because we lose volume with time. We want to actually minimize the pore size and really hydrate that skin to give it that overall smooth, radiant glow that people are really looking for. We also want to correct any kind of dyspigmentation, whether it be hyperpigmentation, whether it be other dyschromias, or even erythema from rosacea or just from inflammation. And we can do that with any number of treatments. Then we need to tighten the skin, because with everything, with aging, we tend to lose bone mass. Our muscles tend to contract less tightly. The collagen fibers tend to fragment and lose some of their resiliency, and the elastic fibers lose their recoil. So we start to sag. We get those jowls, and by losing some volume, that's when the wrinkles start to develop. So we want to kind of tighten that skin with various procedures, and then restore and redistribute that volume to give us more of that youthful appearance. So there's many things that we need to address in a full kind of skin rejuvenation regimen. So I like to kind of divide the procedures up that I do in the office into those that affect the epidermis, and then those that mainly affect the dermis, and make sure that I combine both of those in their treatment regimen. So basically, I like to start everyone on the cosmeceuticals and the home care products, especially the alpha hydroxy acids, some of the regimens, and we have so many wonderful products that this will actually help exfoliate the skin so that our procedures, whether it be a laser light, can penetrate more uniformly. It can disperse the pigment so that we can actually have a less risk of developing post-inflammatory hyperpigmentation. And you can even see the patient's compliance to see when they use the home care products, are they going to be able to continue with a regimen? Are they going to follow instructions? Are they going to use sun protection and sunscreen after to help maintain the effects? I also like to combine chemical peels with almost all my procedures, whether they be interspersed as a treatment like 3 weeks after I do a laser procedure, or even sometimes in the same session. I'll do chemical peels the same time with Botox, so we'll go over that. But I think virtually everybody can benefit from a chemical peel due to its stimulatory effects, its exfoliating effects, and just maintaining the effects of the procedures afterwards. So then for the other procedures, whether it be, I call them more targeted procedures. So if I'll do IPL if someone has an issue with pigment, if they have visible telangiectasias, rosacea, or lentiginous, I'll combine those with the IPL. Sometimes I'll use vascular lesions, just depending if they have angiomas or port wine stains or something, pigment lasers. And then if they want an overall kind of resurfacing, I will go to the fractional resurfacing or microneedling. I tend to like to use microneedling if patients have more of the melasma as a pigmentation. And I stay away from the lasers with melasma just because I think the heat from that laser procedure can really activate those cells and cause a post-inflammatory pigmentation. Whereas the microneedling and the fractional laser, I like to use to help deliver products into the skin, whether they be the pigment lightening agents or whether they are just giving us a full surface, from dermal to epidermal renewal by causing that little injury. But I think they're overall kind of more universal procedures that will give us more of the dermal and epidermal in one. I still will combine like chemical peels and products with the microneedling and fractional laser, but at different time intervals. So, but the ones where we really need to combine are with the ones that only cause dermal repair. That's where we really need to provide some type of epidermal resurfacing to make them look like they have a younger and more youthful glow. So I just wanted to mention that when we combine the procedures, and I'll go over some of them kind of individually and how I like to combine them, is that you want to be careful so that you don't combine two like dermal procedures or two epidermal procedures on the same day or within a limited amount of time, because you could cause significant injury and increase the potential for complications. So for example, you probably wouldn't want to do fractional resurfacing and a chemical peel on the same day, because that chemical acid would go just pour into those little microcolumns of thermal destruction and get into the dermis and cause too significant a reaction. You don't want to do anything where you're going to cause a lot of extensive dermal edema, such as with like an infrared or tissue tightening laser that can cause a lot of edema, and then do Botox, because it could cause the Botox to spread or disseminate and have untoward effects on it. So you do want to be a little careful so that you're able to isolate if there is any kind of reaction, you know what procedure it's coming from so that you can, correct it and deal with it. So let's take a look at how, when we do a cosmetic consultation for skin rejuvenation, what we do with our patients. Initially, we have them come in and we'll do a photography. We like to use imaging. We like to use the Visia imaging system because this will give us a nice printout and a standardized photograph. So that then I'll sit down with the patient and go over, their brown spots, their ultraviolet damage, their wrinkles, their texture and pore size, and then I'll actually kind of formulate a complete or comprehensive plan. And then we can talk about what their budget is going to allow them to do, what things they'd like to address first, because many times they can't afford to do everything all at once. So like I said, we'll typically start them on some of the cosmetic or cosmeceuticals to actually just enhance their cell turnover and exfoliate, so they will get some nice benefit from that, and then outline the different products. And I think Wendy Lois had outlined how they do like a year-long plan. Ours may not take a year long, but we can talk with them about their budgets, and then we actually, towards the end of their treatment, we do another Visia and show them the customized results. And so we have to make sure that we really do produce results, because they can see it objectively, with the computer analysis here. So you want to make sure that you're using effective treatments and combining them to give you the most effective treatment. The other thing is you want to talk with the patient to find out what their major concerns are, because some people might like this little mole on their cheek or the brown spot. So you want to make sure that you're on the same page and correct what they want corrected. So then, like I said, we formulate our little plan, and we could say that there's many different treatments you can use, to address certain things. Some people might want faster results with no downtime. Some people they don't care if they have the downtime. They want the results within a week. They've got a week off of work, and they want to come back looking, 10 years younger. So you can talk about different options. So you can do, chemical peels for fine lines and wrinkles, or even now the new Therapy lifting serum that will give you some nice results with the fine lines and wrinkles. You can do IPL for the pigmentation, the lentiginase, or you could do a YAG laser. You could do the fractional resurfacing, or your fillers. So there's many different options that you can choose from for each area where they have problematic photoaging. Then we like to package these products and procedures. So many times if we say that there's going to be a procedure, if it's one of the more non-invasive procedures, such as, say, the microneedling, the fractional laser, or the IPL, we do multiple treatments, because we don't like to give them too significant a treatment at one time, because there's an increased risk of complications, and over time we can actually get a better result by stimulating that skin growth and then actually repeating the procedure. So we kind of like to bundle these. We say it may take 3 or 4 treatments of the microneedling or fractional laser. So within that bundle, we'll also include products. So we kind of increase the price a little bit to include the price of products, but then we know what they're using prior to the procedure to prep their skin. And then we give them products to help maintain the effects of the skin after. So we always have, sunscreen, some of the PHAs for recovery. We may have some of the products that exfoliate more, like the retinoids or the alpha hydroxy acids, to use prior to really prep that skin. And so we outline these different procedures and then packages, and then kind of give them a discount so that we can tell them if you complete the series, it's going to be a lesser price and you're going to get a better result, to try to encourage them to participate and proceed with the whole procedure there. So, like I said, the first thing I like to do is get them on the cosmeceuticals, and then I like to try them on a chemical peel, because the chemical peels will really help their skin feel nice. They'll have a good result. It's a minimally invasive procedure that virtually almost everyone can benefit from almost any skin condition. So it'll provide a uniform skin surface so that if we're using a laser or even our IPL light or PDT, that it'll, by exfoliating and giving that uniform skin surface, the light can penetrate more uniformly. It can also help improve the barrier function. It'll enhance that cell turnover and decrease some of the pigmentation to minimize the risk for post-inflammatory hyperpigmentation. Plus, it has the anti-aging benefits also. So the peels are actually, we do it in usually a series of superficial peels. We'll intersperse them between our additional treatments so that they may do 1 or 2 peels that may be 3-4 weeks apart of the glycolic peels, and then we'll do a laser treatment to address a specific targeted need, such as the erythema or telangiectasias, lentiginous, and then go back and do the peels to help maintain their effects and give them that overall rejuvenation. We can combine the peels with the toxins like on the same day. I don't like to do it with fillers on the same day though, because of the increased redness, and we want to make sure we know what they're reacting to. If your patient, say, can't afford a laser, such as the IPL or YAG laser for lentiginous, one little trick I often do, if they just have a few little spots, is I'll lightly freeze them with cryotherapy and then do a chemical peel immediately following. And this will actually help prevent that little ring of hyperpigmentation sometimes you can get if you're freezing like seborrheic keratoses or freezing lentiginous. So if you don't have a laser available, or if they can't afford the cost of that, this is just another little trick that we sometimes do. Microdermabrasion, we actually don't use as much anymore. Patients seem to like it because it really made their skin feel fresh and smooth, but it's kind of been replaced with some of the microneedling and the other peels. Sometimes we'll do it before a PDT to allow that aminolevulonic acid to penetrate the skin more readily. Sometimes we'll do it if they have real thick, leathery skin before we do even a peel or before we do our laser treatments also, because it does target the epidermis mainly with a little bit of dermal stimulation just from the mechanical effect of the peel injury. This was a study that years ago that we did using glycolic peels and microdermabrasions. We kind of alternate. Every few weeks we do a peel and then a microdermabrasion, a peel, a microdermabrasion. And you can see they did actually get a significant improvement in the fine lines and wrinkles and some of the pigmentation. Just another one showing even on the coarse rhytids on the forehead, and some of the pigmentation improved with it. But like I said, it's something that they'll do more in the salons now and not as much in the clinic. IPL is probably our workhorse laser. We use that a lot being where I'm from in the Midwest, because we have a lot of fair-skinned individuals with rosacea. So if they have visible telangiectasias, I like to use either the IPL or one of the vascular lesions to address those telangiectasias. If they just have the diffuse redness, chemical peels will actually improve that rosacea so that they don't really have to have a laser procedure. If they do it over time, it will improve that barrier function and increase that epidermal thickness and have enough rejuvenation that the rosacea will actually improve. Their skin will become more tolerant and less red and reactive. So usually we use this, like I said, for vascular lesions, pigmentation. There's other IPLs you can use for hair removal and even for acne treatment. So it is a treatment that we use. They do get a significant amount of redness and edema, so I would not actually do the same procedure on the same day as maybe with a dermal filler just because of too much redness. I would probably use it with Botox, because I don't think there's enough swelling to cause that toxin to migrate. I don't do them on the same day as a chemical peel. I intersperse them between the treatments. So IPL about 3 weeks later, the chemical peel, and then another one to help maintain those effects. This is actually one where we did a combination of IPL and glycolic acid treatments. And you know the chest and the neck can be very difficult to treat because of the risk for scarring, that you can't use a real high energy laser. And she had a nice improvement of her hyperpigmentation here. Here was another one that we did a chemical peel, and a week later did the IPL, and just one treatment, she had a marked improvement of the, the telangiectasias and even the overall pigmentation. So she was very pleased with the results. So our tissue tightening lasers and our, like fat reducing lasers don't give us any kind of surface change. So that's when we need to really combine them with the rejuvenation treatments for the epidermis, such as the chemical peels, the products, even microdermabrasion. So we don't like to do these on the same day though, because of the tissue tightening, with the energy that you have to provide to get down to the dermis and below to tighten that skin just causes too much dermal edema. So we want to make sure that we don't do the Botox or fillers at the same time, just because of that that dermal trauma and swelling that they get. So here was just one where this was just after 5 treatments with one of the infrared tissue tightening lasers. Unfortunately, this was before the triple firming neck cream was available. So I think we could have gotten even better results if we had had that available, because that's actually one of my go-to treatments combined with any of the treatments. Now they have, I don't have results from it yet, but now they have microneedling with the radio frequency attached to the microneedling. And so I think that is actually a much better tightening agent than what our previous ones were. The ablative laser resurfacing, I really don't do in my office much anymore. It's just too aggressive, and there's too many potential risks of hypopigmentation and prolonged healing. We've all switched to the fractionated, either erbium or fractionated CO2, but this one would have significant downtime, and you want to aggressively prep the skin prior to this procedure with your home care products and with your chemical peels, and then use them as healing agents. It's very important, your wound care after an aggressive procedure like this, where the skin is very raw, and then to help maintain the effects by using those post-procedure products to help promote healing. So the fractional laser resurfacing is probably our second most common procedure, well, maybe third. I think ours are, our Botox and fillers and chemical peels are all up there very equally, and then fractional laser is the next treatment. It's a little bit more aggressive for the chemical peel. I like to use it to deliver cosmeceuticals into that dermis, because with the fractional laser, and we do about 4 treatments, because we're really only treating about 20-25% of the skin at a time, because you get these little micro thermal columns of destruction that go into the dermis to stimulate a dermal skin renewal and epidermal. So immediately after this procedure, we apply some of our cosmeceuticals. The one I mainly do is aminofill. There you have a 2% like they call it back bar or stock size of the aminofill that you can apply to the skin almost immediately to get that to penetrate into the skin, to provide the building blocks to stimulate that hyaluronic acid and that dermal matrix production. If patients have melasma, sometimes we'll put like a hydroquinone. They have the Neostrata Pigment Lightening Gel that contained a 2% hydroquinone. I don't know if that's available. I don't think that's available over in Europe, but we can use one of the Enlighten pigment gels. You want to be a little careful with the cosmeceuticals that you apply, that you want to make sure that they don't contain silicone or dimethicone, because there have been some cases of granulomas reported afterwards from those getting down into the dermis. So the bionic lotion is a great one, or I'm sorry, bionic serum, and the aminofill serum we apply to really try to enhance and plump up that epidermal and dermal compartments. Here was just an example. After 4 treatments, she had a nice improvement in the pigmentation and with the coarse wrinkles. This is without Botox also. This is another fractional laser that she had some pretty significant acne scarring and erythema, and it filled in nicely. Again, after 4 treatments, we do them about a month apart. And then, actually, these are about 6 weeks apart. We did the peels at 3 weeks after the treatment, and then 3 weeks later did the laser, 3 weeks chemical peel, and another 3 weeks the laser. This is another one that had post-inflammatory hyperpigmentation and acne that actually improved significantly, and this is in a darker skin type to show that it can be a very successful treatment there. This is one for perioral rhytids, and this is without filler, that she had a combination of 2 wavelengths of the erbium, the 1540, which penetrates a little bit deeper, and then the 2940, which is a more superficial. This would be like the Fraxel Restore or the Halo laser. So when you do the combination, you get a more uniform or more deeper and superficial effect. Microneedling, like I said, is very similar to the fractional laser, but it's less costly. And like I said, I like to use this one more for patients that have melasma, because you're not getting the heat generated by when you actually produce those little micro punctures into the skin. I like to deliver the cosmetic products or cosmeceutical products to also enhance that dermal stimulation. And this is where I'll use some of the pigment lightening gel to try to deliver it into the skin to help reduce that melasma. And we've had some, actually some pretty nice results with it. They do get, have a few days of downtime, maybe 2 to 3 with both the microneedling and with the fractional laser. So you want to make sure they use good post-care products, including the sunscreens, like the Sheer Protection Physical Sunscreen, and some of like the bionic lotions, which are restorative and promote healing and are less irritating. Again, avoid the silicone with the microneedling. The PDT or blue light therapy, we use a lot for actinic keratoses and photo damage. I know over here they are using it even for the superficial skin cancers, as they use it with the red light and have different forms of this available. This we will often do maybe a chemical peel, or this is where I will sometimes use the microdermabrasion to kind of strip off that stratum corneum to allow the penetration of the aminolevulonic acid. They do get kind of a sunburn-like reaction, so they do need it's important to give them good post-care products that are soothing and good sun protection, especially for that 48 hours while that aminolevulonic acid is still in the skin and can still react. Our Botox, what I just threw this up for was that you're still going to need that epidermal resurfacing and to give them that glow. So with chemical peels, I will often do a chemical peel and then do the Botox immediately after. The reason I do it after the peel is I just don't want the acid of the chemical peel to get in the little needle pokes and cause more erythema. We have not had any problems in doing this for over a decade, I know, with migration and of the Botox to get any other nerves that it shouldn't be. So I think that's a good treatment to do at the same day. We also will do Botox and fillers the same day. I really don't do lasers with any of these procedures on the same day because there's just too much chance for injury unless I'm doing a totally separate area of the face. Dermal fillers, that's providing that hyaluronic acid or that to help really plump and restore the volume. As I said, I did mention yesterday that instead of fillers, they're trying to call them volumizing agents now, and they're trying to actually kind of redrape the whole face by injecting a lot of these products, which, many patients, at least where I come from the Midwest, it's pretty conservative. They don't want to put in 3 to 4 tubes of this and have their whole face redraped. So we still do kind of more localized treatments. So I still like to call them fillers, but we do need to volumize that skin, and so combining that with our cosmeceuticals again, and then with our chemical peels will give us a nice surface glow and make that a uniform surface to make it look much younger. But be careful because you don't want to do anything that can cause too much erythema that could maybe compromise the vasculature when you're putting this the filler in, to make sure that you don't get any kind of necrosis, or you want to know what's happening with each procedure. So putting it all together, here we have a patient, and this is a 53-year-old woman. She has glabella furrows. You could certainly do Botox for that area. She also has fine lines and wrinkles. Here I would definitely do the Tritherapy lifting serum will help, or the Bionic eye cream from the Skin Active line. You could do, toxins here, but otherwise the glycolic peel will help a great deal with this. Here, for her nasolabial folds, marionette lines, I think a filler. For the upper lip, you could certainly do a little filler or the chemical peel. And then for her little acne scars here, the fractional resurfacing. So, you can proceed with like one treatment and see how she does, and then you can say if she needs additional treatments, then proceed with the other treatments, go a little bit more in depth. So here's a patient that we did a little Botox filler and a peel. So you can see here her little crow's feet that improved nicely with the Botox, and then the chemical peel. And here's a close-up of it that you can see that it was markedly improved. Here's another one that we did Botox, filler, and peels. So here we did some Botox, we did filler in the marionette lines and the nasolabial folds, and then the chemical peels for the overall skin texture. This is a patient of mine who was in a car accident and sustained a significant laceration to his lip and chin, and he was very distraught with that. So we did 5 of the fractional laser treatments interspersed with the chemical peels, and I applied just a little bit of Juvederm, and he had a very nice result. So, and this was in less than a year's time. So again, this is another gal that had come to me. She had had Mohs surgery for a basal cell and had a terrible scar from it. So we tried to do the fractional resurfacing and the chem peels, and we did get a significant improvement. Here was just a lady with photoaging, and you can see her her rhytids, and so we did a little fractional laser interspersed with the glycolic peel, and she had a nice improvement. And this is just showing the photoaging, the coarse wrinkles, and the chin, and how they did improve significantly. Here was just glycolic peels, and with Botox that can help smooth out the surface and give the skin a nicer glow. You can see it helped reduce some of the coarser rhytids here and smooth out the skin surface. Another one that underwent fractional resurfacing, some Botox for the glabella and forehead, a little filler, and she still looks natural, that she wasn't overdone. And another patient that had a marked smoothing of her skin with the chemical peels and with the Botox and filler. This is one from Dr. Helen Torek, who had done some laser resurfacing and then Botox and filler. You can see she had a more rejuvenated appearance. So in summary, we need to combine many of these procedures together, since the overall trend is towards these minimally invasive procedures where patients are really insisting on less downtime and maximum results. So we want to choose our procedures and combine them together safely to give us the most effective results. So you want to use caution when you're doing the procedures on the same day, and package your treatments so that the patients will get a much more beneficial overall result.